Good afternoon. Welcome to the New Jersey Black Issues Convention, to the conversation that we will have today entitled Impact of COVID-19 on Black Mental Health. My name is Sheila Thorne. I'm president and CEO of my own company, Multicultural Healthcare Marketing Group, and I have been focusing on the health and healthcare of people of color for about 27 years. I have the distinct honor and privilege of joining with Dr. Winston Price. He is going to be our clinical expert today in this conversation. Dr. Price is over 4 decades of experience in the medical field. He has certified in pediatrics, and he has done medical work in family medicine, internal medicine, and pediatrics. He was the 105th president of the National Medical Association, representing the interests of almost 50,000 African-American physicians and their patients. In addition, Dr. Price is Chief Information and Technology Officer for W. Montague Cobb NMA Health Institute, and he has been a senior consultant to private technology services companies. So I am honored and distinctly have the pleasure of introducing to you Dr. Winston Price. Welcome, Dr. Price.
Thank you, and thank you, Sheila, for this opportunity to share these thoughts with you.
Thank you. Well, as you well know, and as we all know, March 10th, 2020, the World Health Organization declared COVID-19 a global pandemic. Probably the first time many people even heard that word. But then over about 2.5 months later, a 36-year-old African-American man by the name of George Floyd was murdered in the streets of Minneapolis at the hands of overzealous, inhumane police. And although these two things seem separate, they really were related, because they both glaringly illuminated health care disparities among people of color, certainly around the globe, but definitely in the United States. So Dr. Price, it definitely has taken its toll on a number of populations, but given your almost 50 years of experience in the medical field, have you ever seen anything like COVID-19 before?
Well, it's an interesting question, but when you think about the issue of pandemic, we really define a pandemic as an illness or a disease that has spread globally and impacted individuals globally. And so it's a nice segue as you brought in the George Floyd issue and the social injustice surrounding that, because that has been a pandemic for many, many years. Yes. And we know that the killing and suffering of people of color at the hands of law enforcement and other individuals in positions of authority have been going on for years globally. And so, yes, I've seen a pandemic before. I unfortunately, just like you, have also lived through the HIV pandemic, which continues to ravage our society, although we've made tremendous strides in terms of controlling the disease and making it a livable disease.
Yes, and you're so right. I mean, it seems like people of color and certainly African Americans have already experienced an epidemic in a pandemic, haven't we?
That's correct.
We definitely have sustained injustices and inequities for a very, very long time. But has anything like this in history ever happened before, Dr. Price?
Right. Well, I don't want to burden you with too many slides, but I think if I go through a few slides, it will help to frame the issue that we're dealing with respect to this particular pandemic. Pandemics are not new to America. They're not new to the world. And as you see on this particular slide, I've only shown the last couple of centuries with regard to pandemics, but they go back to biblical times in terms of the number of people who suffered, the number of people who died, and also the impact that it's had globally. And we have a number of pandemics that are ongoing, although, again, as we begin to create solutions to the pandemic, the number of deaths are reduced. And you see that although we've had 1 million deaths related to the pandemic in the major part of the early pandemic, It has expanded tremendously over the last year and a half. But when you look at the HIV pandemic, you see that 25 to 35 million deaths. It continues to pale the COVID-19 pandemic. But that said, we continue to work towards reducing the impact of pandemics on the people here in the United States and globally. More than 4 million deaths worldwide does not necessarily make it the largest pandemic that we know, but we've surpassed here in the United States at over 600,000 deaths, the largest impact of a pandemic on the shores of the United States. And globally, you see that the number of cases of 232 million begin to get to the stage and level of the Black Plague and other pandemics that have plagued the history of this country.
Yes, that's so important because so many people think this is new, that because we haven't yet felt all of those pandemics on our shores, it hasn't happened. But you clearly have shown that this is not new, unfortunately.
And so, the issue with regard to whether there are impacts from this disease, we know disproportionately, and through your multicultural health marketing firm, you're well aware of the issues with respect to the impact disproportionately on communities of color. And so the early part of this pandemic had tremendous impact on individuals who didn't have the opportunity to avail themselves of the resources, the social distancing, the hand washing, access to healthcare. And so the social determinants of poor health outcome rose to the top. And those individuals who were essential workers and didn't have the opportunity to protect themselves suffered disproportionately. And we saw that in the Black and the Latinx community.
It's interesting, Dr. Price, that when the pandemic hit, there was global chaos, as you know, and obviously people were catapulted into depression, confusion, fear, anxiety, uncertainty, and that has sustained itself. And so mental health then becomes a paramount concern, not only from biological, physical health, but what have you observed in your practice about the impact of COVID-19 on the mental health, particularly of people of African heritage?
Yeah, it's been a tremendous impact. We've seen about a 33% increase in the expression of mental health disorders, spanning from anxiety disorders, depression, substance use disorders, individuals who even have issues in terms of attention deficit hyperactivity syndrome. We've seen, unfortunately, because of some of the lockdown, an increase in the amount of domestic violence and the amount of gun violence, the amount of crime in communities. And so it's had a tremendous impact, which is ongoing because the anxiety level, as you can imagine, prior to the development of a vaccine was tremendous. But then the political overtones, which you alluded to in terms of George Floyd and Breonna Taylor, and it goes on and on and on. All of that impact and the financial uncertainty and the evictions, the job security, the food insecurity, created additional pressure on not only individuals, but on families and communities. And those communities that already were suffering prior to the pandemic are feeling this effect disproportionately.
Yes, you gave a litany of things that impact African Americans more than other groups on a daily basis, even without a pandemic.
Exactly.
So when these kinds of things occur, you and I both know that there's a stigma in the Black community about even admitting that you have some mental health disorders. How has that played out in these groups with regards to first responders, EMTs, and the like?
Yeah, so that's been an ongoing problem, and some of it is inherent to some of the long-standing racial overtones with respect to mental health. Some of it is related to the aggression that people were seeing in society related to the trial and the Black Lives Matter movement and the pushback, some of the disjointed policies that the African American and Latinx communities, the Asian communities suffered during a prior administration highlighted the vulnerability of those communities. And so through a pandemic, through job insecurity, through the vulnerability of essential workers who are primarily people of color into that mix without a vaccine, and you can imagine the tremendous impact. And so some of the bias that was going on, both implicit and explicit bias, accelerated because when certain parts of our society began to turn to these essential workers, primarily people of color, and feel that they were spreading the disease, there was even more stigma for those individuals to not mention about their stress and their anxiety and their depression for fear that they would be identified by the community as not doing well. And, you know, historically, I don't know if I have a slide on that. Historically, if you look at the behaviors of people, 75% of people with mental illness report that they've experienced stigma. And part of it is because of how society responds to them. In the Journal of Health and Human Behavior, 38% of people do not want to move next door to someone who says that they have a mental illness. Wow. 56% do not want to spend an evening socializing with someone with a mental illness. 33% do not want to make friends with someone who lives with a person that has a mental illness. You know, at 68% do not want someone with a mental illness to marry into their family. And so you see this negativity that is presented by being bold enough to admit that you have a mental disorder when you have the pressures of not only your community, but your family trying to help you minimize the fact that you have a mental disorder. And we know that what happened historically was that mental illness was characterized during the Jim Crow era as a behavior manifestation of slaves who were being treated too kindly by their masters. And so when a slave had a mental illness, it was viewed as an individual who was rebellious, who was angry. And you've heard the term, the angry Black man. So what we produce in our society is individuals in communities of color trying to minimize, trying to self-medicate, trying to deal with it, trying to say that we've gone this far under the pressures of slavery and we've been resilient. So what I'm feeling as depression or schizophrenia or anxiety, I can deal with this because we've had worse.
So we kind of internalize it.
Yeah, and so when you have a society that was allowing law enforcement and other people in authority to imprison, to treat substance abuse disorders as a criminal act, to minimize the impact and import of people of color, to kill them, to make them feel less than human, then you can understand the evolution of stigma to say, I know what I'm feeling inside, but I'm not going to let it out. I'm not going to let anybody else know about it because it's only going to be detrimental to my health.
And doesn't that also, I'm sorry, doesn't that also go into the myth of the Black superwoman? The fact that you don't need anything. Yeah, you're taking charge and you're not going to admit a weakness. And certainly with Black men, that's often the case as well.
Absolutely. And this pandemic has been disproportionately affecting women and even maternal health in our society. And a lot of it related to, you know, the postpartum depression, the prepartum depression, all of that is normal, but these women don't want to reach out and ask for help for fear that they'll be further stigmatized And because of the inability to have adequate access to healthcare,
Mhm.
adequate access to behavioral health, the ability to pay for mental health services and substance use disorders, exacerbates
Mhm.
why people don't want to address the issue. And, we're still fighting through the beneficial effects of the Affordable Care Act. But,
Yes.
there are many states that won't, you know, pass on to make sure that we have the options of expanding Medicaid so that it's available to more people of color and more people in need. And we say people of color, but rural communities
Mhm.
and poor white communities also suffer from the same stigma. And it's unfortunate that we have such pushback from certain segments of our society that create more havoc for some of these social determinants of poor health outcomes. And the pandemic you throw on top of that, and we're where we are right now.
Dr. Price, talk about children. I mean, all of us have been concerned about our children. We've all been disrupted professionally, personally, socially, but our children, youth, how have they had the effects of COVID-19 in terms of mental health issues or disorders?
Well, it's been pretty much the same. We've seen more children experiencing anxiety.
Mm.
You can imagine because they're not in their normal comfort zone of
Yes.
being around their peers and friends in a school setting. And as I mentioned earlier, an increase in the amount of domestic violence, so they're being exposed to more ACE trauma, adverse childhood experience, and also the fact that they're in a setting where themselves are more likely to be abused in the home setting because they're
Mm.
shut in for weeks on end, and that sometimes will, particularly for children who have special needs,
Yes.
but also for children in general, where the parents are already at their end of the straw in terms
Breaking
of
point, right?
pressure, and they don't know
Mm-hmm.
where food's going to come from, and they're
Mm-hmm.
waiting for an eviction notice, and so they become very short-tempered when the child says, I want to do something different. I don't want to be in the household. I want to play. I want to
Mm-hmm.
throw the ball. Well, you can't throw the ball in the house. So what happens? Things and the temperature in that household rises, and things many times often gets out of hand.
You and I both know Dr. Ron Bailey, who's also a past president of the NMA and a psychiatrist, that he shared something with me, a new category called race-based traumatic stress.
Mm-hmm. Yes,
The fact that it's not just your normal stress every day that we always go through, but it's like pressing your foot on the gas and never letting up.
exactly.
So in Black families, what does that level of stress do to you biologically?
Well, we know that several of the chronic illnesses are affected by stress. Your cortisol levels, some of the inflammatory markers in the blood are increased under stress.
Mm.
And we sometimes refer to the slave syndrome,
Mm-hmm.
where we know that a lot of the hypertension, a lot of the cardiovascular disease, the arthritis are related to an increase in the inflammatory components in the bloodstream. And so when you have stress over a period of time related to a pandemic, related to job insecurity, related to homelessness, related to waiting for that eviction notice,
Mm.
you're going to have all of those hormones and adrenaline rush going on in your body. And so, if you have a chronic illness,
Mm-hmm.
unfortunately, cardiovascular disease, hypertension,
Mm-hmm.
arthritis, and even some of the chronic illness of diabetes, obesity, and cancer, and you're not able to get to your routine healthcare provider for the care that you need because of the lockdown and limited services, and now with the strain on the healthcare system
Mm-hmm.
related to those individuals who are not vaccinated taking up the space in emergency rooms and in ICUs, then everything just mushrooms into an uncontrollable situation. And it's a vicious circle, because the more stress, the more your disease is out of control, and the more the individual is likely to suffer. And for the first time in nearly 50 years, we've seen a decrease in the life expectancy in the United States.
Huh,
A
interesting.
decrease, despite
Wow.
all of the efforts
Mm,
in a country with the highest per capita expense for healthcare,
mm,
and our life expectancy is going down.
my
And of
goodness.
course, the Black and Latinx and the Native American, Pacific Islander community are suffering disproportionately in that respect. And we, it's going to take probably 10 years
Hmm.
for us to get back on the trend that we need,
Wow.
because you can't just decide, well, we have a pandemic for 2 years, and so you're going to get a third of the care, preventive care, you're going to get a third of the chemotherapy for your malignancy, instead of we checking your diabetic risk every 3 months, we're going to do it once a year. And so, these individuals are going to suffer tremendously. Their life expectancy is going to be shortened, and it's going to take us a while to catch up. And add on top of that, the burnout factor and stress level that we didn't talk about for the healthcare workers and
Yes.
the other essential workers. And so while we already have a shortage of nurses that we've been struggling with for the last 25, 30 years, more than 60% of nurses indicate that they're going to shorten their career as a result of the pandemic.
Wow. Wow. That's troubling and disturbing.
It's very troubling.
Very troubling, because we're already trying to help individuals take charge and control of their health. And now the services won't be available, and those delivering the care are having issues as well. I also saw a statistic about a spike in suicides among young Black men.
Yes.
The hopelessness that they see already, and this is just exacerbating that. Well, we know the problems. We've talked about them, and they are of deep concern to us. How do you, as an adult, Black adult, cope with all of these things? Food scarcity, eviction, job, losing. I mean, how do you deal with all of that?
Yeah. So we're asking people to, despite the difficulties and lack of resources, to reach out to your community, reach out to family. I personally have worked along with my immediate family. We've had a weekly Zoom call every week since the pandemic started. And we just share experiences, we communicate, we talk about things that we probably haven't had the opportunity to talk, because during holidays you get together, where's the food, so somebody's here, goodbye, and the next holiday.
Yes.
But we get into a deep dive in, what are you feeling? How is the pandemic affecting you? We talk with the children who come in on the Zoom call. We ask them what they're doing. And so this has been a tremendous stress reliever for us within my family. But we want everybody to do that. And we also want people to find a trusted healthcare provider, even if they don't have a doctor of their own.
Yes.
Which we want them to find and associate with. Then they should find a trusted healthcare professional that they can talk with and get the facts. Because there's so much misinformation and disinformation about this pandemic, about the vaccine, about the treatments, that we have a whole subset of individuals who are suffering because they're going down the wrong rabbit hole with regard to how they're managing their stress and their illness.
Yes, I've been working with some pastors too, because the churches have been shut down. So many of them have Zoom services and Zoom calls. But you're so right, that trusted voice. Who can you talk to and get your feeling? I love the idea of having a family session on a regular basis, whatever that may be. That's an excellent suggestion. And because you're so steeped in technology, I wanted to talk about telehealth, because those services have been kind of the stopgap, because you can't go to your doctor. How valuable are telehealth services during this time frame?
It's been tremendously valuable during the height of the pandemic in April, May, June
Mhm.
of it's hard to imagine 2020, but
Yeah.
most of the healthcare facilities restricted any face-to-face contact with patients at all. And so telehealth was a boon to those medical practices to be able to interact with their patient base and to begin to have a semblance of normal healthcare
Mm.
for those individuals. The problem with that is, there's a disparity in the ability to have access, both for certain practitioners in communities of color,
Mhm.
but also for consumers in certain communities. And I think I may have a slide about a number of studies that were done. So this was a study that looked at telehealth services for individuals over the age of 65.
Uh-huh.
And it became an important access to care for them because they were
Mhm.
replacing their regularly scheduled appointment with a telehealth visit. But you
Mhm.
see the disparity when you
Yes.
look at a number of white individuals who had access to that level of care as
Wow.
opposed to the Black and Hispanic.
Mm.
And then you look again at the metropolitan to rural disparity, and you see that it is a major impact on the ability to receive care during the height of the pandemic.
Well, you know
And
what?
so
Mhm.
this has been one of the issues that we've been addressing at the federal level and at the
Yes.
state level to try to make sure that some of those COVID CARES Act dollars went into broadband access for a wider community, disaster preparedness. And because of that lack of having a smartphone or having stable Wi-Fi for people of color, they weren't able to access the telehealth to the level that it could have provided them with an interim measure to access of healthcare until the pandemic is over. And we're still suffering that disparity.
Well, I have to tell you, this is such a timely conversation because I've been working here in New Jersey with legislation that's currently sitting on the governor's desk to increase or continue telehealth services to pass the Assembly and the Senate flying colors. The
Okay.
governor hasn't signed it yet. So I'm
Okay.
working with some community activists that are very, very concerned as to why the delay, particularly since we're going through these variants. It's Assembly Bill 4179 and
Okay.
Senate Bill 2559. So anyone listening, if you want to know more about this legislation and find out why the governor hasn't signed it, we urge you to get informed so that you can keep this going the way that Dr. Price has said, happening all over the country. There aren't many options for people of color, and it's completely reimbursable. So the technology has certainly had to jump to the occasion, hasn't it? And
It has.
do you see this continuing, Dr. Price?
Oh, absolutely. And the technology has evolved similar to sending SpaceX with civilians into space.
Right.
Technology has advanced to the degree that smartphones can do a lot more than it did 20 years ago. And so measuring blood pressure, having blood glucoses sent directly to practitioners, monitoring individuals' risk of having exacerbation of their congestive heart failure, monitoring the asthmatics in their homes, monitoring the shut-ins have evolved to the degree that we can provide pretty much the same level of care for chronic illness management through a telehealth connection if we can assure the patient at the other end of the connection has a stable and secure broadband capability. But the technology is there, the equipment is there, and we just need the bills that you described to pass at the local level. And I must say Medicare stepped up to the plate, and a lot of the insurers followed suit in terms of reimbursing for the telehealth visits as though they were face-to-face. If they did not do that, I can assure you that this healthcare system and the impact on the health of the American people, particularly communities of color, would have suffered even more than they're doing right now.
Dramatically, yes. How does telehealth work with mental health?
Well, behavioral health, because of the nature of that illness, lends itself to having a remote face-to-face interface. And so there's been telepsychiatry even before the pandemic.
Oh, really?
That has been used. Several of the emergency rooms that don't have a psychiatrist on their staff, the emergency room personnel know that they can dial into a telepsychiatry consult center and allow for that face-to-face through the remote interface with a psychiatrist. And what we only lack in that particular component is the inpatient treatment facilities when that becomes a necessity, and of course the drug treatment rehabilitation. But short of that, the majority of individuals with psychiatric disorders just need a therapist and a counselor that they can talk to, who can assess how well they're doing on their medication, make adjustments to their medication, and then keep them out of the hospital, and also keep them off of the street. Because again, getting back to your earlier point about stigma, we have a problem in our country where mental health is treated as a criminal illness. And so when someone is suffering with a breakdown in their mental illness, the healthcare service that people turn to is 911. And most of the law enforcement are not equipped or trained to handle a mental health crisis situation. And unfortunately, as you know, and all too often, the treatment that they use is in the form of a bullet, a stun gun, and handcuffs, and a knee. And that is not the treatment for mental illness.
My goodness. I mean, we had a literal knee on George Floyd's neck, but as Black people, we've had a figurative knee on our necks for quite a long time, haven't we?
We have.
And that's something that we have to deal with. So are you optimistic? Are you confident that if we as a community, Black people in particular, come together and support each other, that this is survivable, this is doable, that we can maintain some measure of mental healthiness so that we can function during this pandemic?
If every eligible individual registers to vote, and every registered voter votes, not just in the major elections, but in the local elections at the community level, and become active in expressing their voice collectively, then we have a unique opportunity to utilize the pandemic in a positive way to create the framework for all of the things that we know are necessary to address the social determinants of poor health outcome. And one of the things that I've been preaching this whole pandemic is, where was those buckets of $3.3 trillion when you and I were trying to deal with health disparities in the 70s and the 80s and 90s? And local governments and state governments and federal government saying, well, we can't provide health insurance to 20 million people because we don't have the money. We can't provide more behavioral health treatment centers and inpatient because we don't have the money. We can't make eye care and foot care part of your basic healthcare package because we don't have the money.
Or dental care.
Or dental care. And if they did that up front, 10 years ago, we would have been positioned to handle this pandemic in a more effective way. And hopefully moving forward, I think the administration is trying their best to get this infrastructure bill, because the infrastructure played into that is adequate roads and adequate protection against the climate change disasters, so that communities of color don't suffer when there's a pandemic or other crisis. And that's what we need to have in place. And so, voting rights,
Yes.
criminal justice,
Yes.
police reform, and also the pandemic survival for infrastructure. All of that's integrated.
All connected. Yeah.
That will improve the lives of all Americans across the United States.
No question. I hear you loud and clear, and I've witnessed you and your commitment to that political process as well. We've got to educate ourselves. We have to be in the mix. What's the saying that they have, Dr. Price? If there's no chair at the table, bring in a folding chair.
Exactly.
You've got to make your voice heard, because otherwise they'll keep doing the same thing and we'll keep having the same problem. So
that's correct.
Part of it's our responsibility. You're also working very hard, as you have throughout your career, to increase the number of people of color, young people of color in the biological sciences. How is that going? Because we certainly want to see somebody who looks like us when we do get into the system.
Yeah, absolutely. I mean, the STEM programs, as well as the pathway programs to create an avenue for individuals to get into the health sciences at all levels, to also be in the process of doing the research that we know is necessary, to be at the table, not on the menu, with regard to some of the decisions that are being made with regard to the healthcare benefits. I think that this administration has a cabinet that looks like America. And so decisions, I am hoping, continue to come forward in terms of the funding for the HBCUs and other minority serving institutions, so that we can cultivate a continuum of excellent practitioners and researchers from the communities of color. And for this pandemic, we've got several luminaries of color who have been there in the forefront. Casmikia Corbett, Dr.
Oh, yes.
Absolutely. There are probably 40 or 50 names that we could run down the list in terms of the import of those individuals. And there should be thousands of individuals from communities of color involved in not only solving the problem, but also in looking forward with regard to where we need to be.
So in the few minutes we have left, Dr. Price, what advice would you give to those in the Black community who are suffering under mental illness or mental disorders or confusion, fear, anxiety, depression, as we go through this pandemic? As you said, it's going to be around for a while. This is not a 2 or 3 year jaunt. This is a marathon.
It is. And there are a number of resources that are available. The 5 steps that the that the National Institute of Mental Health asked. If you think you're going to hurt yourself, if you're a family member, keep them safe. Be there for them, listening carefully, help to connect them with the National Suicide Prevention Lifeline, and stay connected with them, whether it is by phone, by texting, TikTok, whatever. Don't just leave them to deal with it themselves. And then lastly, there are treatment facilities all over the place to help them find the kinds of resources they need, specific to suicide prevention, substance use disorders, also with regard to disaster distress, mental illness treatment facilities, veterans crisis lines. All of these are available to individuals, but when they're having a crisis, they're not organized necessarily thinking about what they need to do. And so we're asking the community to come to their aid. And there are a number of programs that exist that you may be familiar with that we're doing in Georgia, where we're training behavioral health aides. And these are lay people who we have go through a training course where they become more expert to recognize the early signs of mental health disorders. and to point those individuals, not just family members, but anyone in the community, whether you're in a grocery store, and you notice somebody is being fired, and you notice that they're not handling it well. So you don't have what occurred this past week, where the person then goes home and gets a gun and comes back and shoots people.
Exactly.
Those signs of the mental health were there before that incident.
Absolutely.
And so we need people to recognize that. And that's what we want people to become more versed in. And you and I will try to make that happen.
Absolutely.
I just appreciate the New Jersey group bringing this to the forefront, because it's by this collective action that things happen.
And in our African tradition, we always say it takes a village. So we've got to come together. I don't have any children biologically, but when I see children of color, they're my children. So I reach out to them, give a positive word to them, commend them. And I know you do that as well in your professional life too. So it definitely takes the community coming together. But I also, like you suggested, get involved in changing the system, get involved in the policy piece, make your voice heard. And we know how to do that. This has been an extremely informative conversation, Dr. Price, past president of the National Medical Association, a pediatrician, clinician, activist, health technology expert. You've given us some good things to think about, and I think we can all take advantage of them. Even if we think we're under control, we need to have people that we can reach out to, and I hope all of those who listen to this will do that. So thank you, Dr. Price. It's a pleasure, always an honor to work with you, and look forward to the next opportunity. So New Jersey Black Issues Convention, we hope this has been helpful. We hope that you will reach out to some services in your local community, your local physician, your faith advisor, whomever you feel you can trust, to talk about how you're coping and dealing with COVID-19 pandemic. Thank you for your attention.
Thank you, Sheila.